Well, the fallout from COVID is actually everywhere. The National Cancer Institute reports a 70% decrease in cancer screenings, which could mean an additional 10,000 additional cancer cases. Dr. Shweta Kurian is a medical oncologist, hematologist for the MedStar Health Cancer Network in Baltimore, and she is joined by Dr. Zeev Gamliel, Chief of Thoracic Surgery at MedStar's Franklin Square Medical Center. Thank you both for being with us.
Thank you.
Thank you for having us.
I'm happy to have you here. I actually want to start with you, Dr. Kurian. What screenings are you seeing most people cancel or delay due to COVID-19?
So what we were seeing is where patients have to come in, like for mammograms, cervical cancer screening, colon cancer screening with colonoscopies, or just a visit to a physician for a check for melanoma. All these screenings are being delayed because patients are just concerned about the safety of coming in. They don't want to get exposed.
And since we know that early detection is so important, what is the message that you want to send to people who may be skipping these screenings and for reasons that they think are actually smart?
Absolutely. COVID definitely is a big issue, big problem. We are scared that we might get it, and it's not something we know we can treat, cure. There are consequences of getting it, but we do know what we have seen is a lot of patients, because of the delay in terms of getting screenings, the number of patients that have been diagnosed with cancer during these periods when the screening had decreased is much lower in comparison to previous years. So what it's telling us that these people are delaying their cancer diagnosis. It's not that in this period of time, the cancer has suddenly gone away and lesser people are being diagnosed. It is because things are getting delayed. We're not finding them. So when we find them, it's months out or a year or 2 years out. We have lost that precious time when they could be diagnosed earlier and care can be given earlier.
And Dr. Gamliel, that's what I want to ask you about too, that possible impact of delaying the screenings or the treatments in terms of the different stages of cancer. What is that impact?
So we know that early detection is absolutely critical for ensuring the best possible prognosis for patients with cancer, and lung cancer is no exception to that. The longer a cancer is allowed to remain undetected, the greater the possibility that the cancer is going to progress to a stage that might be much more difficult to cure or impossible to cure. So even though there is definitely some risk associated with screening, it is likely that the risk of screening is less than the risk of skipping the screening, even in the midst of the COVID pandemic, as long as appropriate precautions are being taken for patient safety. I would encourage anybody who is at risk for developing lung cancer to follow through with their scheduled screening, just in case this is the year where, God forbid, you might be discovered.
Right. And talk about the things that the early diagnosis can affect. Is that in terms of treatment or outlook or all of the above?
There's no doubt that it is much easier to treat cancer in its early stages than to treat cancer in its advanced stages. And so patients who are discovered to have cancer at an early stage can expect to have a relatively streamlined course of evaluation and treatment and an excellent prognosis with an excellent quality of life afterwards. If patients' cancers are discovered at much more advanced stages, then their treatment regimen is going to be much more challenging, much more prolonged, and is much less likely to be successful. And if they do get through their treatment with a successful outcome, they are more likely to have lasting after effects for their treatment.
And for patients currently receiving treatment, they should continue to come to the hospital, correct?
Dr. Kurian?
Yes, absolutely. Yes, I think it's very important that patients who are getting their treatment to continue coming because, we have made sure that our facilities are clean, safe for our patients to come in. They cannot, who have been diagnosed, their treatment plans is not something they can take a break and come back when coronavirus is over because cancer is not waiting. Cancer continues to grow. So if you have a plan which is already formulated and you are getting your treatments, it's very important to follow through and complete those treatments. We on our side, as your providers or your physicians, make sure that the facilities are safe for you to come in and get those treatments.
All right. And then again, just to remind people, because they're going to want to know the safety precautions that are being taken at the hospitals. What do you want people to know about them? That this is just it's ongoing. It's the cleanest place you can be, the hospital. What is it that you want to drive home?
So I can tell you for our offices, when people are coming in, they are being temperature checked. Everybody is. All the personnel is masked. There are hand sanitizers everywhere. You know, we care. I think the responsibility is for each person too, because we don't want to carry anything to our homes either. So everybody's taking excellent precautions here. Everybody's masked. We have a shield when we go see patients. And so at the outpatient setting, these are the precautions we're taking. Inpatient, I know Dr. Gamliel can explain more about patients who have to go through surgery and at the hospital setting.
I just want to thank the patients that we have been treating for their cooperation and real participation in this endeavor. Everybody's been taking this very seriously, staff members, patients alike. This definitely is a less convenient time to pursue treatment for cancer. Loved ones are sometimes not allowed as much access as they would under normal circumstances, but everybody's been very understanding and cooperative, and I think that the results speak for themselves. We've had a very clean track record.
I want to thank you so much for being with us. We also want to let everyone know that MedStar experts will be answering your calls during tonight's House Calls segment on WMAR beginning at 4:30 p.m. We'll be right back with more Midday Maryland right after this. Stay tuned.